empowering Oriental medicine practitioners' clinical expertise in Korean, Sanam Acupuncture and Master Tung Acupuncture. In our initial encounters, self-introduction takes precedence. Therefore, before embarking on a collective learning journey, I'll introduce myself. About me. Name Kim Sunnam. Education South Baylo University 2002-2007. South Baylo University Doctoral Leave of Absence 2009 to 2012. Professional experience. Gold Acupressure Therapeutic Massage College Instructor 2003 to 2007. Trinity University Therapeutic Massage Dean and Clinic Supervisor 2007. Western Hospital Therapist Acupuncturist 2009-2015. Specializing in acupuncture techniques including Saamdam Acupuncture, Dongssi Acupuncture, and Bongtong Acupuncture. Herbal Medicine Expertise X. Clinical Practice. Operating 6 days a week Monday to Saturday. Daily sessions from 8 a.m. to 7 p.m., with 1-hour treatments per patient. Weekly clinical average Monday to Saturday 50 patients. Monthly clinical average 200 patients. Annual clinical average 2,400 patients. Total number of clinical trials conducted 16,800. 2015 Western Hospital. Provided acupuncture treatments for 120 patients. Worked on Tuesdays and Thursdays, 2 days a week, from 8 a.m. to 6 p.m. 2015 Present Sun Acupuncture Group, Inc. Certifications. Acupressure Therapist 2005. NCBTMB National Certification Board for Therapeutic Massage and Bodywork 2007. CFMP Certified Functional Medicine Practitioner 2020. NCCAOM 2020. I initiated my writing journey with the aim of dispelling negative perceptions about Korean Saamdam Acupuncture and encouraging fellow Oriental medicine doctors to embrace it in clinical practice. While my theoretical knowledge of Korean Saamdam Acupuncture and Master Tung Acupuncture was substantial, I lacked practical experience. However, by immersing myself in actual clinical practice and conducting numerous trials, I can now share valuable insights based on my hands-on experience. In my perspective, clinical practice holds equal importance to Western medicine knowledge and theory. Proficiency in treatment techniques is honed through real-world practice, and I encourage others to engage in clinical trials whenever possible. If my fellow Oriental medicine practitioners could use these techniques in clinical practice without preconceptions, biases, or negative perceptions about Korean Saamdam Acupuncture, I believe that my personal clinical journey will have been truly rewarding. In conclusion, the Chinese phrase, Ku 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 Zhang Ji Xing 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 Li Wei, is a personal favorite of mine. It translates to, go, 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 you know, do, and do you realize? While it can be interpreted in various ways, I believe the most fitting interpretation is to learn through continuous practice, rather than waiting for complete understanding. As the saying goes, the training of 1,000 days is called Dan, and the training of every moment is called training. Together, these two constitute training. Discipline is not solely about sacrifice, but also about daily practice and self-realization. By persistently practicing without pause, one can experience something new in every moment. This process brings joy and revelation, much like the enjoyment of daily training in disciplines such as Muay Thai and Jiu-Jitsu. For me, motivation has never been a necessity, as the quest to understand what unknown yesterday was and learn something new tomorrow is a driving force. It's not about waiting for the aha moment, but about infusing meaning into every movement and practice, rather than remaining stagnant in theory. This, I believe, is the essence of personal growth and development. I think that clinical practice is as important as knowledge and theory of Western medicine. Treatment skills seem to be gaining in actual clinical practice, so I think you should try clinical trials as much as possible. So, if my fellow Oriental medicine doctors can use it well in clinical practice without prejudice, or negative perception about Saamdam Acupuncture, it seems that the story of my personal clinical experience, which is not in vain, was rewarding. Ku 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 zhang ji sheng 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 li wei. This is my favorite word. That means go, 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 you know, do, and do you realize? It seems that this word can be interpreted in several ways. However, I think that the most appropriate word is not to act after realizing it first, but to learn as you practice. The training of 1,000 days is called Dan, and the training of emergency is called training. Together, these two writings are called training. It is easy to think of penance when it comes to discipline. But penance is not the only discipline. Training every day and awakening will be practice. If you continue to practice without stopping, you will realize something new every moment. That is the joy of training and training. It seems like every day repeats. But the truth is that every day awakens new things. That is the most enjoyable time while practicing Muay Thai, Jiu-Jitsu and other martial arts. I never needed the word motivation to realize what I didn't know yesterday. And learn something new tomorrow. Exercise every day. It seems that the word above is not meant to be like that. Every moment is experienced and realized. It's not easy, but if you don't stop, won't you get to know it? It is to put a meaning on moving and practicing, rather than on retrogression and theory. I interpreted it that way.